My dad suffered from Parkinson's and then later on with dementia. All the things that we are trying to prove here were real for him. And you know what? The balance between mobility and mental well-being was just such a challenge. I'm not sure now, with the benefit of hindsight, that we ever got those decisions right. We were always chasing perfection. Where we are now from where we started, Penn Health, Cisco, Monash, the Outcomex team, every time there was a can we, should we, we've been able to deliver outcomes that far exceed anyone's expectations.
The National Centre for Healthy Ageing is a collaboration between Monash University and Peninsula Health. It was established about 5 years ago, and it aims to support healthy ageing in the region of the Mornington Peninsula, but also more broadly across Australia. The Smart Ward has been established by the National Centre for Healthy Ageing, and in the Smart Ward we have installed a range of digital technologies to help support patient care and also clinical research. Older people in these settings have particular issues with deconditioning and functional decline, and a lot of that is related to the fact that they don't move around as much on a hospital ward as they do perhaps at home. So being able to capture the amount of physical activity that patients are doing in these settings is really important for helping to prevent deconditioning and functional decline. Another clinical use is understanding the amount of time that patients are spending in proximity to staff members. By using that information, we can have a better understanding of what types of patients are likely to use the most amount of staff time so that patients can be more fairly allocated to staff. So it really helps with staff workflows as well. We want it to be staff-led. So whatever they tell us will be useful is what we hope to implement into the system.
The nurse is always here for 1:5 ratio during the day, but afternoon 1:6, which is only 6 staff on the ward, and then night duty only 4 staff on the ward to have 30 patients here. If we have this technology in place that we can identify the why this patient's wandering around. Is that patient going to the toilet often? Why the toilet is that, for example, to go into the toilet is so important? Is there any infections? Is the patient constipated? These things that we can monitor, and maybe this will reduce our, hopefully, acute delirium on the ward.
So essentially what happens is the patient wears the device around a wristband, and it's put on their arm in a very non-obtrusive way, and the information is collected in real time via antennas on the floor. That information is transmitted and it's put in the cloud, and from our standpoint there is an API that's able to pull that data on a scheduled basis in whatever interval that we need, and then we can take that data, store it in an anonymized way in a database, and we can use that to perform analytics and hopefully contribute to better patient outcomes in the future.
So the Smart Wards project aligns with our digital health strategy by making sure that we're being able to do more for our patients, their staff and their families. We need to make sure that we're providing the best of care always, and as part of our collaborative approach, we're working with the likes of Outcomex, Cisco, the NCHA and at the IT department themselves to deliver a super important project that will enrich the lives of all that use it.
I think I went through the normal grieving process, but there was always something. I was just looking for an opportunity to get involved in Parkinson's in some way. This project kind of came and found me.
Biggest thing I've enjoyed about this program is the collaboration. So we've got NCHA, we've got IT, we've got the program management unit, we've got Outcomex. This is a true chance to showcase what IT can do at the very edge. Like, this is patients' lives. And for me personally, that's why I'm in public health.